In case you haven't heard, America's medical industry is pretty yacked, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around. If you did not hear episode 1 with Dr. Kurt Lindberg, he discusses his own personal journey since 1999 and how he even lost a patient that could have been avoided had we really changed the minds of everybody here on our health system. Here in episode 2, we start really talking about that divisive title, universal healthcare. And we're going to talk numbers and what that really looks like and how much we actually pay right now for our single payer health system.
Priority Health, that is based here in Michigan, is owned by Corewell Health. Yeah. And, you can see, especially when you work in healthcare and you look at the plans that are laid out, you can kind of understand where it's like, hey, if you see this HMO plan and you're able to see these doctors and all of this telehealth and such like that, it's all funneling back to Corewell Health on that. And so, it's
and there's no restrictions, by the way, on Corewell Health about how much money they can make. I don't think.
No, absolutely not. I mean, they're CEO, and that's exactly it too. You have the people, I'm all about trickle up economics, right? And so you have very educated individuals that are not making as much as the administrative executive in there. And you have people that are out there saving lives. You have people out there that they do want to work on a preventative basis on things. They don't want to have to see the patient in the emergency room, that has that cough or anything else like that, because they want to, deal with some of the bigger cases as well, because there's no money in any of that, right? And so how a health system as large as what they are owns their own insurance company is
it's a
puzzling.
fully integrated system, which you can look at Kaiser Permanente and Intermountain Healthcare and trying to think of some of the other big ones, Allegheny, I think out in Pennsylvania. So it's a model that's done. They have different names, so it comes in a little under the
for sure. Yes.
It comes in under the radar when they don't sound the same. But that's an efficiency. You go back to it. We've decided to have healthcare be capitalistic. Yeah. That's a great way to have an efficiency is when you have a fully integrated system from beginning to end. And if you are an insurance company owned by a healthcare system, then you of course are going to look out for the best interest of that healthcare system as opposed to another. So that's unintended. Yeah. That's the unintended. That's the negative side. Yeah. One of the negative sides to what we've chosen to do.
In it's again, as I made the statement even before recording, as far as the general public and not understanding and pushing back on things like universal health and being okay with a capitalistic country.
You've mentioned universal health. When I did my TED Talk, I was trying to make the point that universal health care would lower our costs.
Yeah, absolutely.
So I don't think people understand that, because I think all they see, and I hear this from my own family members, we should not be paying for people who are here illegally to get health care. And they're angry and upset, and they're voting with that kind of passion.
That's the part that makes me crazy.
But what I don't think they understand is they are already paying for illegal immigrants to get health care. They're doing the most expensive kind, which is going to the emergency room, because we can't turn them away. Yeah. So we had a case here in Holland of a person who was undocumented, so they're an illegal. Yeah. And they had their kidneys had failed. So we showed up in the emergency room and we put them on dialysis, got them better, sent them home. They got sick again, brought them back into the ER. And after about 10 cycles, someone finally decided it would be cheaper to pay for dialysis for this person than it would be to bring them in the ER and in the ICU every time. Yeah. And so that's what we ended up doing. So I think this is the kind of case where we're spending so much more money, and we're a less healthy population because of that kind of dynamic. Yeah. If you are sick, you go to the ER, we have to take care of you. We might as well pay for prevention. And this is the argument. I think we have to decide as a society, what's our priority here? Is our priority to penalize lazy or illegal people? Is that the number one priority in our country? Or should our number one priority be to save money and have an efficient healthcare system? Because those two, I think, are in conflict.
Well, it's really great news for the media to talk about the illegals, right? but it's not such wonderful and entertaining news to talk about preventative care, which is mind-boggling. Social media feeds into that everything. And again, my goal is for people to be able to take to the polls, to help understand, to help this.
Yeah. So I intentionally, when I did my TED Talk, I intentionally did not use the word universal healthcare because I know that's a dog whistle.
You're right.
And I know we're a very polarized society. And if the other side thinks it's a great idea, then I hate it.
Right.
So I'm trying to use language that's neutral, but help make the case that I think it's in our best interest. And I have a extremely conservative good friend on Facebook who watched my TED Talk and he said, that was great. I totally agree with you. And I didn't reply, but I probably should have. That if you agree with me, then let's go ahead and get this going. Yeah. And we can start making some changes and get everyone covered for preventive health.
I am so glad that you brought that up because there are so many different instances that I have avoided certain, like triggering words in that regard. And even when I coach my doctors to how they talk to patients as well too, right? If you use the word out of network or non-participating, all they think of is this big booklet they have with their health insurance. 98% of patients don't realize that they have dental and medical and it's different. And they see two columns, one in and one out of network, and there's hardly any coverage for it. So I have to have my clients changing different conversation of we're not directly contracted with them. So it's great hearing you. And I never even thought about the fact of identifying different ways that I could communicate universal health without saying it, because you're absolutely right. And that's actually, to me, the audience I want listening more.
Right. So people who don't want universal health care get upset at people who are taking advantage of the system and getting stuff for free, and they want to prevent that. What I don't think they understand is they're not penalizing that individual because they're going to get healthcare anyway.
Yeah.
They're penalizing the healthcare system because they have to take care of them for free.
Yeah.
So that's what another little bit of an aha light bulb I hope goes on somewhere when we're making national decisions is healthcare is going to be given to everyone in our community. So whether they're here legally or not, whether they have a job or not, they're going to get healthcare, and they're going to get it through the emergency room. If we want something that functions, we need to pay a healthcare system to take care of people in the right way. So it would have to be a universal, and there's going to have to be some governmental. And again, everyone's going to ask me, well, how are you going to do that? Because Medicare for all is a bad idea. Well, Medicare for all is one way you could do it, but I'm open to other ideas.
And that's exactly it. And I think that's why, because as you said, that's such a triggering opportunity, that universal health, and we could call it comprehensive prevention,
or paying for prevention for everyone in our community were the words I used. Everyone in our community, sometimes they're here illegally. And here in Holland, we have a good number of undocumented immigrants.
Absolutely,
and they're getting health care.
And, but even in countries that offer their healthcare to anybody, there's medical tourism that's moving and going into there as well too, and receiving that care. And there still is satisfied doctors, satisfied patients. There's so many different things that's going on. Why not? My son was just in Spain for his semester. He's in 10th grade, and he hurt his wrist. And he comes home and he's like, Mom, they had to put a cast on it. They did x-rays. They did all these other things. And the only thing we paid for was the medicine. And it was like $3.
I think I hear that story frequently from Americans abroad, that they're a little shocked at how great of care they got for a low out-of-pocket cost for them. And I hear the opposite, too, of people from UK that are visiting here. And they're like, I don't understand how to do this. And I'm like, well, join the club.
Yeah, right. We're all with you here. If you can figure this one out. It is. And, recently having a friend diagnosed with cancer, and even then talking to different alternative care models, because I do think, and I can't help but keep pushing the fact of, the cancer care that we provide is a very, very, profitable system for the hospitals or anything else like that, right? And there is alternative medicine. Don't get me wrong. I'm all about Western medicine, but there is health care that's being provided in different countries as well too, that has proven to shorten the duration of the care that they have to provide, perhaps even decreasing the amount of chemo radiation or whatever. One of them in particular, my client went to in Mexico, called Hope for Is it over cancer, I think? And again, I don't know much about them. I'm actually going to be going down and I'm hoping to interview them. They have interest in it. But, she went down there she had her surgery here and she didn't want to have chemo. So she went and tried this and now she's been in remission for over a year. I don't know the specifics of her care, but it was the one thing that she did say is it's a whole health approach. They made sure that during this entire time of me receiving the care and receiving the medicine that I needed for my cancer is that I was having the correct amount of vitamins and nutrients and that I needed specific to me because they was running these things during this and they were monitoring this and making sure as well too, right? In this comfortable environment and a handful of things. And she was like, that's why I chose it. Because again, you're exhausted when you're here and you're going through cancer care and stuff. Like the idea of saying like, I'm just so tired. And I guess that just comes with chemotherapy. Right? Like that I'm just feeling awful or anything, I don't think really has to be it. And I think that would have better outcomes because it's this whole health system. And when I asked her how much it cost her to go there, she had 2 rounds and it was a kind of a year package per se. And it was $50,000, which the normal American can't afford. And she had even admitted that she had to kind of move around funds to make sure that was available because most people don't have that just sitting in a bank account. But to know that $50,000 for the same care that would have been here, how much that would have cost.
Yeah, a lot of the costs, and I'm not an expert in oncology care, but a lot of the costs I know is related to the medicines themselves,
Absolutely.
right? And you always want the newest, best, latest one, which is always the most expensive.
Absolutely.
But yeah,
Absolutely.
that's a big cost in the U.S. because we have such a fragmented system. We can't do en bloc negotiating with a pharmaceutical company. So that's why United Kingdom, who has the National Health Service, right, has 1/10 of the cost of something like Ozempic as we do, because they are voting with one, they're negotiating with their entire, continent there.
And it just is so necessary. And it's, again, even, there's all of these different things that come up as you're bringing it up, like Ozempic and, the different diabetic medications there, that even I have this, I just get so frustrated because I realize that there's, like I said, all these tentacles and big pharma that's out there and, how much money and profit that they're making off from these different things. But then you have the insurance company dictating the appropriate medicine that's coming from it or not. But then the insurance companies, again, too, the doctor can go ahead and say, I want my patient to be on Mounjaro for their diabetes. And the insurance company says, no, we're going to have to put you on this medicine for 6 months first. Yeah. And then we'll pay for the big one.
Yeah, that is, again, I understand. So I don't want to bash insurance companies because I understand what they're going through.
Saving that
They've
money.
Negotiated with Mounjaro's competitor a lower rate.
Yeah.
So you need to start with that one before you move on to the other. Well, again, that's what.
Vicious cycle.
The immediate problem is the fact that we don't negotiate as a whole country.
Absolutely.
And if we did, we could drive the rates low on all of them.
100%.
Yes. So you have a fragmented system that allows this type of thing.
Which, again, it's baffling to me. And, as I'm talking this through again, I'm starting to think about how some of these larger insurance companies are purchasing up some of the smaller insurance companies. And I don't know actually if it's the same in health insurance, but in dentistry, we have umbrella plans. So there might be this Dentamax that has this negotiated rate for which they'll reimburse insurance companies, and the insurance companies can go ahead and contract with them. And so the doctors receive this Dentamax reimbursement, but it's kind of a convoluted system because umbrellas, the insurance company can negotiate with multiple ones. So somebody might say, I have Cigna. I can't tell you how much it is because we have all of this overlap that's going on. And so, to me...
Price transparency, you've probably heard this being talked about. And, I sometimes I hear politicians talk about their own family's healthcare and say, well, we looked at, my son broke his arm and we went to the the ER that was considered the most quality or the lowest cost. You can't find that information, right? Especially if you're having a heart attack, please don't look up on the internet what's the cheapest ER.
Yeah, just wait here just a moment. I'm going to go ahead and find this out for you.
So just to say that I understand the reasons why that is, because we have different contracted rates. You said Priority Health has so many different plans. You can't even just say Priority Health and know how much it's cost because it all depends. Yeah. What's your deductible? What place is it? All that information. It's very, very difficult.
It really is. And again, that administrative burden aspect of things, and,
and the convoluted, is how hard it is to navigate. If we think patients should choose the cheapest option, how are they supposed to find that out?
Absolutely.
Yeah, it's
Absolutely.
almost impossible.
And I mean, then you have the insurance brokers on things as well too, which to some extent, I understand what they're doing. Yep, it's exactly. That's really all it is.
Business's job is to make money. Yes.
And so to me, it's kind of funny because they think about it as far as, me and my husband are both business owners. I'm too small to even have to offer insurance, thank goodness. Right. But, for his side of things, and the broker comes in, and a broker is, they're going to offer the plan that's going to go ahead and lower. And at that point, it was only an HMO plan. And I know exactly what an HMO plan is, but my husband or his HR or anything, they don't know what the heck it is. And I was like, you should be offering different options. But the whole thing is, I'm like, at least offer the options. Maybe there's somebody that's a little bit more educated, because HMO isn't for everybody.
Yeah. This goes back to what I was talking about early, is the people who are making these decisions on what happens in American healthcare don't understand American healthcare. So you have HR people being told they need to keep healthcare costs down. How do they know how to do that? I think they should be going to having the
certificate or something.
Lowering the barriers to preventive care. I think that would work. And I'm trying to prove to the nation that this works. But they don't know that. So they go to a conference, and the conference talks about, X, Y, and Z, product that you can buy, that you can lower your insurance. And then they go put pressure on their insurance carrier and say, I need you to provide X, Y, and Z because I heard at a conference it works. They don't know what they're talking about.
They have no idea.
So
and again, too, that HMO network aspect of it too is, I at one point, I'm like, I feel like you should have this PPO and you should have an HMO and everything, but they're always going to go with the HMO. But I'm like, aren't any of the family members, aren't any of your employees complaining that it's such a system to have to go and see a specialist? Like they have to go porting through all these different ways or anything. So then people just give up.
Right.
So it's so challenging.
I think, we talk sometimes about the better ways to handle a situation where you're motivating patients to not do unnecessary things is to have a greener pasture rather than higher fences. So if you can say it's free, so I get this all the time with patients. They say, my knee hurts. Can you send me a referral to the orthopedic doctor? Because my knee hurts. I don't want to go see you, pay that deductible and copay, and then you just refer me there. I want to cut out the middleman.
Yes.
But they don't understand I can handle 80% of knee problems in my office. And if it was free for them to come in, they would take advantage of it in a second. So that's another example of how, but then what we've done with some of these HMOs, we said, no, you need a referral from your primary care physician. We've put a restriction on them. We build fences, as opposed to make it a better option that they would choose in the first place, which is it's free to see them. And maybe they can fix it without having to go see an orthopedic surgeon. By the way, the second word is operative there, is they are surgeons. So
absolutely.
They might not need their surgery.
It really, it does. It generally comes down to that as well too. And I want so much to educate on it. You know, you have that one visit per year that, is your testing and your evaluation and
Make
such
sure
like
you're up to
that.
date on prevention and all that.
And then visits after that cost $10 or $35, but then there's a deductible if they need something more. And it's just, why would we want to go back to our healthcare or our doctor? Because in our head, I want to go right to the source that's going to be able to fix my problem, whatever it might be, and this vicious cycle and convoluted cycle. I think to myself, as we're talking about just like all of these numbers, I can see Katie Porter writing it all down on her marker board, and kind of going through and being like, what's wrong with people? Like, we can afford these things. The amount of money that is spent in premiums and deductibles and the debt that's coming out of the emergency room, having that funnel in some sort of way. I ask people all the time, they're complaining about how much they pay a month on insurance. And I said, okay, hear me out. What if you put that 100% of that premium, that $1,300, $1,400 you're paying for your family into taxes, that you do. And now you have unlimited amounts to visit and you don't have to worry about anything. And I'm getting people to be like, okay,
Yeah, it's hard. And there's a lot of people who are healthy out there, and you'd hear about people going into medical debt and, having to file for bankruptcy based on medical, debt. It's people who are gambling, and because we don't have universal health care, so you can choose to have insurance or not. So you can choose to pay $800 a month, or you can choose to have $0 a month. That sounds like an easy, decision right there.
Yeah.
And I'm healthy, and I don't see the doctor much. But then I don't know, next year I'm going to get in a car accident, or next year I am going to have cancer diagnosis, and then I'm going to have more costs than any one person could ever cover, and you're going to need an insurance company. So again, this goes back. I'm beating the same drum here.
We're going to beat the same drum over, but
lowering the barriers to prevention and making sure everyone has access, that they don't have to choose whether they're going to have it or not. I think the original idea behind the Affordable Care Act, and it became a political football, was that everyone was going to have healthcare. That was kind of the initial talk. And if you don't have healthcare, you're going to pay into the system through your taxes anyway. Yeah. So either pay the IRS money or pay for insurance. That's your choice. But we haven't been able to come to consensus as a society on the advantages of that.
Why do you think that it is such a polarized, I mean, on top of it, of course, the media, and, how much can we get heightened reaction from different sides of it? Again, too, I don't know that I've heard a politician very specifically speak on, we need to focus on 100% accessibility to preventative care to keep people out of the emergency room.
Yeah, I don't think the average politician understands that. And it could be that the average doctor doesn't understand that, right? So I think primary care thinks that of themselves. Yeah. But we are, 20% of physicians in the country. Yeah. In other countries, I'll say it's 40% of physicians. So there's a lot more primary care in other countries.
How do you suppose we get in front of politicians and try to? Is this something
we do podcasts and TED Talks?
I mean, this is true. Yes. But draw it in. Yeah. Yes, you're absolutely right.
Yeah, we try and start the conversation. We try and do so in a nonpartisan way. Yeah. And I hope, and I'm sorry if I come across as bashing any one political party, but I do think both ideas of we need to save money and do things efficiently, and we need to provide good care for our population. I think those are both possible. Yeah. But I don't think people are willing to listen to the other side and agree in the middle somewhere, because I think we stand on our own side and throw snowballs at each other.
Yes, absolutely, absolutely. It's, there's part of me, and I've actually reached out some different representatives and I'm pretty tenacious, and I'll keep on pushing and pushing and pushing, because it has to be a topic. It has to be something somebody can be bold enough to say, again, Katie Porter, please get your marker board out and let's go over this, and because it came from Katie Porter, there's 50% of Americans aren't going to listen, And so again, having something like this, I'm hoping that going to these other countries is enough to pique that curiosity.
Too, right? I think if you're going to have a very big business friendly decision making, this is one of their pain points. Yeah. You go to any large company and ask, what is one of the hardest things? And they're going to talk about cost of healthcare.
Absolutely.
But if they can understand, and somehow they have to be convinced, because they're not reading medical literature, and 80% of doctors out there aren't agreeing with what I'm saying right now. So, and healthcare systems too, right? The hospitals aren't going to tell them, you need to prevent people from coming to me.
Of course.
Yes. Don't listen to the hospital systems. Somehow we need to raise awareness, and maybe this is a time where things are ripe, where people are upset enough, and you start having people championing the murder of a healthcare insurance executive and saying that's a great idea. And it's like, let's bottle that frustration with the system and talk about a fix. Yes, that it's something different than what we're doing, other than murdering people.
Well, exactly. And, the idea of my podcast was exactly that. And then all of a sudden, was just thrown to the light of how insanely important, because people are frustrated with the system that they feel are killing their family, their friends, and average Americans. And it is. Yeah. And so as soon as hearing the news of the CEO of United Healthcare, it's really sad to me to hear that rage. And it's like, this is that much more important why we have to go out there, because you guys are funneling your energy and to the wrong sources right now. Right.
We have to be able to bottle that anger and frustration into a constructive solution rather than just complaining and turning to violence.
Yeah. Absolutely. And it's, I again, too, I want to continue to push and get in front of representatives. And there was I think of some different politicians that say that they don't mind being on some of the different news networks that is not for them and everything, because he was like, how do you get people to see something different? You have to obviously meet to them, go in their arena as well too. And we are so polarized to not even try to cross paths, try not to cross over.
And I too have had talks with politicians, my local representatives, and I understand the position they're in too, right? They're not evil people by any means. They feel constrained to represent their district. If their district feels a certain way, they feel like they need to represent that, whether they think it's a good idea or not. And so, again, part of it, you mentioned going to legislators. I think we need to continue to talk to the public in various constructive ways to get them to support ideas that we think would be a good idea of how to change our healthcare system.
Yeah, it is.
Let's go back to the root. Right?
I know, right? That's exactly it. Right to the root. It's just like keeps. It is, but it's so necessary. Yeah. And again, and going back to even starting this podcast and talking to Eric about it is. At first, I wanted to talk to doctors, and I wanted to be able to have, doctors talk about their story and then relate to doctors over in different countries. And I was like, okay, so we can get the doctors on board to understand this part. Yeah. And then it became so much more apparent that it was like, it's not right to the root. Right. We have to get to the general public.
Ask the whys. Why is this happening? Why does insurance company deny care? Why are big companies going broke because of healthcare costs? Yeah. Why are we against people who are illegals or don't have a job, preventing them from getting health care, or preventing the healthcare system taking care of them from getting paid is probably more correct.
Yeah. No, I would absolutely agree that is more correct. It's, I don't know. There's this absolute circle in convincing the communities and everything, but there's just also so much divide and hatred towards anybody that isn't walking around with blonde hair, blue eyes, here in America as well too, which is really sad and unfortunate. And, there's the politics that to drive in the race for people who are here in the country, the illegals or anything else like that it's again to having them focus on some of the different aspects of it, which tie back to the general public.
Yeah, it's frustrating that the conversation of how do we fix healthcare gets mired down in the discussion about appropriate border control.
Yeah.
Right.
Yeah.
So that is a separate conversation, and I think a very legitimate one. So have that conversation. But people who are undocumented or illegal are in our community, and they're showing up in our ERs, and we have to care for them.
Yeah.
And so how are we going to figure that out in a way that is the most effective?
Yeah.
Right. What's the best way to do that? And just the anger that they shouldn't be here and we shouldn't be taking care of them is not helpful, because we are taking care of them.
Yeah. It's again too that the naive and ignorance of what actually is happening and where some of this money is going, and what it is that we're seeing on there, and finding this opportunity to through podcasts and talking to them and like saying, hear me out, right? Like it's so much more inexpensive to be able to just go to the doctors, not have to worry about $10
if someone
copayment.
doesn't get sick in the first place. And again, I go back to the person I gave an example of in my TED Talk, that my patient, his name is Jack, and if he never had a heart attack in the first place, we would have saved a lot of money. Yeah. So all this talk about denying care, or what is the best way to take care of cancer, or what's the best way to take care of a heart attack, is an important conversation to have. Yeah. I want to go back even further and say we want to prevent them from getting cancer or getting a heart attack in the first place. How do we focus on that? Because that's a so much cheaper and effective way to do this.
Yeah, it absolutely is. What do you think that as far as even when we talk about like different alternative medicines as well too, and what happens in other countries, we have the FDA that is there as well too, and so there's some of that aspect that does prevent some different medicines that are here and going through a process, and also preventing some of the things that we consume, that are causing health conditions and problems as well too.
So I when I do my TED Talk, I have 15 minutes to make a very complex
like, how do
topic.
I get this?
Yeah, I'll tell you one idea. But why does the U.S. pay more for healthcare? Part of it is that we're more obese than the average other country. So that causes more diabetes. That results in more cardiovascular disease. So again, there's more to it than just universal health care and lowering the barriers to prevention. I acknowledge that. So as a society, the presence of McDonald's and so many fast foods and
so
the
many
Biggie
places.
Fries and so there's
at every corner.
Yeah, there's nutrition, and that's another very legitimate conversation that hopefully we're changing. I've heard that Krispy cream donuts is having some trouble with their margins now that so many people are on the Ozempic injections that,
and they're not.
Now they're not making their profits
What's
anymore.
happening?
Yeah, I know. Somehow
People
this
aren't hungry. It's true though.
Yeah.
It just is. It's baffling to me, and I actually, oh goodness, the FDA, everything that kind of gets in the way, the big pharma, and how this all kind of goes down to it.
That is the razor edge of, again, my wife and I have a similar view on just about everything, but she made the comment of why are insurance companies denying necessary care? And me being as close to the insurance companies and being in the rooms with them with these conversations, there's a debate sometimes of what is necessary care, right? And I think you ran into it with your breast prevention. Is that the most effective and cost effective and quality way to do it? And I think that's where you're running into, is there might have been a disagreement, and you'd have to go back to scientific studies and prove it. So I think insurance companies have to make hard decisions that are often unpopular, not doing what we want to.
Yeah.
But they're trying to keep their rates down. I'll acknowledge that. Yeah. They're not making lots of money because they can't. They've been restricted. At least medical insurance has been restricted in how much money they can make. They're trying to keep their rates low. And then they're trying to provide necessary care, but that's where the debate occurs.
Yeah.
What is necessary?
What is necessary and what is not. Right. It's, one of the things with the insurance companies that I have a hard time with, and it's been going on for years, is that auto adjudication process, right? Like it's just something gets submitted out with these certain codes, this person's age, this person's, these layers, and yes or no.
Yeah.
And
that is, again, the part of the cons and the pros and cons of the current system we have. We have decided to privatize healthcare and healthcare insurance and big pharma, and everyone's job is to make money. And that's a negative side to it, is that you have fragmented and you get, people treated as numbers, and you make decisions based on large swaths rather than individualized. Yeah, it's not ideal.
And it's hard because, having the denial and then educating the patient, yet that, this decision, it's made by the insurance company as well. There's nothing that we can do about it. You can fight back and push.
And you can go back. I don't know if you had these conversations. You said that the providers were pretty happy about not getting denials, but there's less accessibility to certain technologies in a universalized healthcare or a governmental run. So I think that's one of the complaints that we have of, say, well, maybe we should go to universal, and people don't get the care that they really want and need in other countries. Sometimes they're not wrong.
No, that
would be the flip side if we were to go in that direction.
Yeah, I would absolutely agree. That is, even when I was in Spain and visiting with the doctor there, it was, he was very excited to be able to show off some technology that we've had here for a very long time, right? And so I love diving deep into the prices for those things and stuff. But yeah, there's never going to be a perfect solution in the slightest bit, but we have to start moving towards the one thing.
There's something better, at least. Yeah.
The better solution is prevention and accessibility to it. Because it's kind of mind-boggling to me. Even and I even bring up too, just recently, just before Christmas, I had a bladder surgery, and the only thing that hurt when I came home was my hips, and so much so, like, trying to sleep was just not even a thing. And I contacted, and all I'm thinking to myself is, I just want one pill that will let me sleep tonight. I'm sure I'm going to be fine by tomorrow. And I was told to go to the emergency room.
Yeah.
If I had to.
Right. And again, and go back to this venture capital company. That is the whole goal of this company, is if we have a set amount of money and we want to make some money on the back end, the ER is the last place you want to go. So maybe we will hire a full-time nurse to go out and help people in the middle of the night instead of going to the emergency room, because that's cheaper.
Well, and even telehealth, you can see and identify. I had surgery, early afternoon that day, right? You can go on MAPS, a system that also is helping, protect drug seekers or anything that you can see. I'm definitely not that. But why am I going to go ahead and spend a $250 deductible to go to the emergency room on the same day that I had surgery, when I'm just like, please give me Valium. Right. Just one pill. I don't need a bottle, and it's baffling to me.
Yeah. And if we had a system, so I'll take your example and show you how we could do this different. Yeah. So if the healthcare company that you got your surgery with said, okay, we have $10,000 to work with, and you have to pay the surgeon, you have to pay the anesthesiologist, you have to pay whatever, and then keep the change. Well, the last thing you want to do is send that person to the ER because you're going to use up all your bandwidth. So you would make an exception, or you would find a way to get that care taken care of. But that system doesn't exist, so it's easier just send them to the emergency room. Yeah.
It's mind-boggling. Yeah.
What a great episode we just had. Dr. Kurt Lindberg, he touched base on how much we pay for illegal immigrants as they're coming over in healthcare. We also address this one-size-fits-all system that we have within healthcare, that everybody's treated the same despite their unique needs. Stay tuned for the next episode with Dr. Kurt Lindberg as we continue down this discussion that is very divisive across the United States. I'm excited for all of you to hear so much more about it.